Hey everyone, welcome back to Medicos. In the previous video, we have talked about the definition, cause, and the type of thrombosis. And today in this video, we will talk about the morphology, fate, and clinical feature of thrombi. When you see the morphology of thrombi may develop anywhere in the cardiovascular system, and according to their location, thrombi can be divided into venous and arterial thrombi, which also includes cardiac thrombi. Besides the difference in the mechanism of thrombus formation at this site, the clinical effects of this are even more different. Arterial thrombi produce ischemia and infarction, whereas cardiac and venous thrombi causes embolism. When we see the gross feature, thrombi may be of various shape, size, and composition depending upon the site of origin. Arterial thrombi tend to be white and mural, while the venous thrombi are red and occlusive, and the mixed or laminate thrombi are also common. It consists of alternate white and red layer called the line of Zahar, and red thrombi are soft, red and gelatinous, while the white thrombi are firm and pale. When we see the microscopic feature, the composition of thrombus is determined by the rate of flow of blood, which means whether it's formed in the rapid arterial and cardiac circulation or the slow moving flow in the vein. The line of Zahan are formed by the alternate layer of light staining aggregate platelets admixed with the fibrin meshwork and the dark staining layer of red cells. Red or venous thrombi have more abundant red cell, leukocyte, and platelet entrapped in the fibrin meshwork. Thus, red thrombi closely resemble blood clot in vitro, but red thrombi or antemortem clot have to be distinguished from postmortem clots. Post-mortem clots are gelatinous and have dark red dependent position where the red cells have settled by the gravity, and they also have yellow chicken fat upper portion, and usually they are not attached to the underlying vessel wall. When you compare the arterial and venous thrombi, arterial thrombi arises at the site of endothelial injury, while the venous thrombi arises at the area of stasis, and the arterial grows in retrograde fashion against the blood flow from its attachment site, and the venous thrombi grow in the direction of flow towards the heart, as you can see in the picture. And the arterial thrombi, they have firm attachment, while the venous thrombi has loose attachment, hence they are propagating. And the arterial thrombi usually occlude the blood flow, and the tail may undergo fragmentation, while the venous thrombi are almost invariably occlusive. When you see the comparison between the thrombus and blood clot, the thrombus is formed intravascular, while the blood clot might be found in either intra or extravascular location. And thrombus is formed from platelet, fibrin, and RBC and WBC, while the blood clot is only composed of fibrin, RBC, and WBC. And the line of Zahar is present in the thrombus, but not in the blood clot. And thrombus have defined shape, while the blood clot is shapeless. And when it comes to the fate of thrombus, a thrombus can have one of the following fates. The first one is embolism. A thrombus may dislodge and travel to other sites in the vasculature. Such a traveling thrombus is called embolus, and it might obstruct a vessel and can eventually lead to infarction of an organ. And we will discuss embolism and infarction in other video. The second one is dissolution or resolution, and in this fate, the thrombus may be removed by fibrolytic activities. And the third one is propagation, in which a thrombus may accumulate more platelet and fibrin, and they propagate to cause vessel obstruction. And the last one is organization and recanalization. Organization refers to the ingrowth of endothelial cell, smooth muscle cell, and fibroblasts into the fibrinous thrombus, and organization is accompanied by the formation of capillary channel across the thrombus, reestablishing lumen continuity to some extent, and this is known as recanalization. The recanalization eventually converts the thrombus into the vascularized mass of tissue, which is later on incorporated as a subendothelial swelling of vessel wall. The clinical effect of thrombus depends upon the site of thrombi, rapidity of formation, and nature of thrombi. Cardiac thrombi or large thrombi in the heart may cause sudden death by mechanical obstruction of blood flow or through thromboembolism to vital organ. Arterial thrombi causes ischemic necrosis of the deprived part or infarct, which may lead to gangrene, and sudden death may also occur following the thrombosis of coronary artery. And the third one is venous thrombi or phlebothrombosis, which may cause thromboembolism, edema of area drained, pool wound healing, skin ulcer, painful thrombosed vein or thrombophlebitis, and thrombophlebitis migricans in cancer. And the fourth one is capillary thrombi, in which microthrombi in microcirculation may give rise to disseminated intravascular coagulation or DIC. To summarize, the morphology of thrombus depends upon the site of origin. Arterial thrombi tends to be white and mirror, while the venous thrombi are red and occlusive. The thrombus might end up embolizing to other parts of the body, or it might dissolve by the fibrolytic activity, or it might progress toward the heart or organize and recanalize and become subendothelial lumps. Clinical effect of thrombus depends upon the site of thrombi, rapidity of formation, and nature of thrombosis, and these are the most common area of thrombosis. You can pause the video and watch them or review them. Thanks for watching. If you like this video, please give a thumbs up and subscribe for more. You can also comment in the comment section below. You can also check my other videos too. Till next week, stay safe.